what can I do in order to utilize breathwork training, enhance my stress resiliency to make me a better athlete or to recover better? So I'm assuming that's probably something that you get asked about a fair amount.
Yeah, breath holds are really, really interesting. And because there's different variations of it, do you hyperventilate and then hold your breath? Do you breathe in and hold your breath? Do you breathe out and hold your breath? How long do you hold your breath for?
Mm-hmm.
One of the exercise that we've been using, well, pretty much over the last 20 years was, we started off with kids, and because children aren't necessarily going to understand slow breathing, but at the same time, we wanted to reduce their chemosensitivity to carbon dioxide. So in short, we would have a child coming in maybe with asthma, and the child is breathing with a relatively fast respiratory rate.
Mm-hmm.
And their airways are narrowed, and that's bringing on their symptoms. And also they have a stuffy nose. So one of the easiest ways to help open up the nose for the kid and help with bronchodilation was to have that child take a normal breath in and out through the nose, pinch their nose and hold, and walk a number of paces holding their breath.
Yep.
And then to let go and breathe in and normal breathe. We practiced that with children as young as 4 years of age, with hundreds and hundreds of kids. With the oxygen advantage, we changed it in order to be able to have breath holding during physical movement. And I remember when I was working with some Notre Dame athletes, they were 400 meter sprinters, and they were at a very, very high level. And we had them do sprinting with their mouth open and monitoring their blood oxygen saturation. Their blood oxygen saturation with mouth breathing during the sprint would drop down to probably about 94, 93%, just on the verge of hypoxia. And if I had them sprint with the mouth closed, it dropped down to about 91%. So going into mild hypoxia. But if we had them jog with breath holding, we could drop them down into the low 80s. And oftentimes breath holding after an exhalation is overlooked because athletes feel that they have to be doing something so strenuous, severe physical training in order to stimulate anaerobic glycolysis and to reduce the ventilatory response to carbon dioxide. And for those of you who mightn't understand what is the ventilatory response to carbon dioxide, when you do physical exercise or even when you're breathing at rest, the primary drive to breathe is the gas carbon dioxide. And if you have a high sensitivity to this gas, to the accumulation of carbon dioxide, your breathing is going to be that bit faster and harder. And it's how you breathe during rest which is going to influence how you breathe during physical exercise. So one of the protocols I brought in with the 400 meter sprinter were as follows. Now it's pretty tough and I wouldn't necessarily recommend it to everybody. I'd have them do some of their sprints with their mouth closed for the first 360 meters. And I stood in the 40 meter line. And at the 40 meter line from the finish, when they seen me, they had to exhale and hold their breath for the last 40 minutes. Sorry, the last 40
I was like,
meters.
wow, man, that's crazy. 40 minutes. That's an intense practice. How many survived?
We did it because I suppose fatigue is going to set in at the last 10% of the race. And 10% of 400 meters gives you 40. And that's when we added the extra load. So what exactly happens now? What I would say to people is, if you're prone to anxiety or panic disorder or any severe medical issues, don't try long breath holds because they're quite a stressor.
Sure.
And there is a balance to what do you want to do, and at what point does a good stress become a bad stress? But listen to your body and start off gentle and build it up. So for example, if you're not pregnant, you're relatively young, and you're in good health, practice this in your sitting room or whatever room in the house. Take a normal breath in and out through your nose, pinch your nose and hold, and walk 15 to 20 paces holding your breath. And do that 2 or 3 times. And after doing a warm-up of 2 or 3 easy breath holds of 15 to 20 paces, with a minute's rest in between each, then take a normal breath in and out through your nose, pinch your nose and hold your nose, and start jogging holding your breath, and then go into a fast jog, and even go into a run holding your breath. And keep relaxing into your body as you hold your breath and keep going until you feel a relatively strong air hunger. And at the end, then resume breathing. But instead of taking this big gasp of breath, minimize your breathing for about 15 seconds, which is about 6 breaths or so. And that will help to prolong the hypoxic hypercapnic response. And I suppose, Jay, if somebody was to ask what exactly is happening when you're doing that, I don't know if anybody knows fully,
Sure.
but here are a few things that are happening. One is, as you hold your breath, your cells continue to extract oxygen from the blood, but you've stopped breathing it. You've stopped breathing. So you're not replenishing oxygen. So as a result, your blood oxygen saturation is dropping. This is forcing the body to make adaptations, including an improved buffering capacity inside in the muscle compartment. So we have buffers which are designed to neutralize acid. So say, for example, hydrogen ions are implicated in causing fatigue in an athlete. So what causes physical fatigue? Generally, hydrogen ion is what's thought to be, a main contributory factor to that. When you deliberately put the body into a hypoxia state, you're forcing the body to adapt, and it is thought that those adaptations is the increased buffering capacity inside in the muscle compartment, which in turn will delay lactic acid and fatigue.
Sure.
Now, in comparison to a sprint with your mouth open, which is tough, or a sprint with your mouth closed, which is even tougher, you could do a breath hold in your sitting room, and you could have a stronger effect in stimulating anaerobic glycolysis but less trauma. Now, I think there's also another thing in terms of the brain, because as you do a breath hold and your blood oxygen saturation is dropping and your carbon dioxide is increasing, you're disturbing the blood acid base balance, but your brain is also getting signaling that you're pushing the body into that almost a severe training, but it's not necessarily severe, but it could be causing a setting of the central governor, that you're telling the brain that the body can push it a little bit harder without overdoing it. And I think there's a psychological thing, because suffocation is a very primordial fear, especially for some people. And that's why I would say to people is go with it easy. And literally you're doing a long breath hold, and it's almost that you have to surrender to the feeling of suffocation, and it's training you to be able to deal with stress. Now, another aspect to what's going on, when you do that long breath hold, you do actually have increased blood flow to the brain. Another aspect that it will help to open up your nose. You're also adding an extra load onto your breathing muscles, because during the breath hold, you will have involuntary contractions of the diaphragm, because the brain is continuing to send increased stimulus to breathe, or increased impulses to breathe, to resume breathing. But obviously you're stopping breathing.